Good morning, and thank you for joining us for All Things Heart. I'm Alexis Del Cid. Right now, we're working hard on bringing you some incredible new episodes for Season 6, which begins this fall. Until then, we will air Encore presentations every Thursday at 8 a.m. right here. So sit back, relax, and enjoy this Encore presentation of All Things Heart. Born months early at just 3 pounds, this newborn also had a heart condition. How our medical team treats the tiniest of hearts.
From the University of Kansas Health System.
I am amazed. The team here is great.
I came on a Tuesday, and then by Saturday I had a heart in me.
I have never seen a group of people work together so good as this team of heart specialists. I mean, it's just unreal.
Stand by to set up show.
And the Dolph C. Simons Jr. Family Broadcast Studio.
Roll it.
Always makes you feel like you're the most important patient on the planet.
I felt heard, and that was really big.
This is All Things Heart.
Good morning, I'm Alexis Del Cid. Welcome back to All Things Heart. We know our medical teams here at the health system save lives every day. When those patients are babies, it's a whole different ballgame. Imagine performing a procedure on a heart that's smaller than a strawberry. Yep, we brought in some produce today. The heart smaller than a strawberry. Allie Cook saw firsthand the incredible work that went into treating her new baby's heart. Her new baby's right here.
Little Archie Cook loves his books, blocks, and like any teething baby, anything else he can put his mouth on. To look at Archie, you would never know how much he's already been through in his short life. In fact, even before he arrived in this world, doctors knew Archie would need a lot of care when he was born.
We knew he would need surgery, but we weren't sure when. They kind of just told us once he's born, we'll know more about his heart and then kind of go from there.
As soon as Archie's mom, Allie, learned her baby had a heart problem, they transferred to the University of Kansas Health System under the care of cardiologist Dr. Kenneth Gertz.
And he explained it so well and drew us pictures every time he would come in. But there's basically I think 4 different parts of the heart that just didn't develop.
Archie was born on November 30th, 2022, 9 weeks early. He weighed just 3 pounds.
It was so scary. Really a terrible. We loved our care and we're very fond of everybody there, but yeah, it was really scary.
Archie remained in the NICU for 3 months and grew stronger every day. In March, he was 10 pounds and ready for surgery.
It was pretty crazy. He was on oxygen for so long. He had his surgery and they're like, yep, all right, he doesn't need oxygen. He can have a normal life. He can do all these things that a normal baby can do.
Archie's scars are fading fast. His mom bought him this lion with a scar on his chest and a red heart. So one day she can tell Archie about his journey into the world and how his doctors at the University of Kansas Health System made sure nothing would hold him back.
He's just like a little miracle baby. That's you.
We are so pleased to welcome Allie Cook and baby Archie onto the program today. So you're going to hear some baby noises throughout this program. Just roll with it because we are loving having, this is my first time having a baby as one of our guests. Yeah. We also have Mallory Bertucci. Mallory is one of Archie's nurses. She's joining us virtually. And here in the studio, we have another one of Archie's primary nurses, Carly Mott. And we also have Archie's pediatric cardiologist, Dr. Ken Gertz. And waiting in the wings is Allie's husband, Andrew, and Archie's grandma. Tell me your name again, Grandma. Kathy. So from time to time, when you see Kathy and Andrew on Baby Watch, if Archie gets fussy, you may see arms swoop in and scoop him up or put him back in his mom's arms as needed. Just rolling with it. What a sweet boy. How old is Archie now?
He is 17 months.
17
at the end of this month, yeah.
And how is he doing? Is he completely out of the woods?
He's doing great. We had his cardiology appointment recently, and yeah, everything's looking great. He still has a leak in the pulmonary valve, I think, which is normal for his heart condition. So yeah, I mean, we just flew to Colorado, and he just went on his first trip.
Oh,
and
fun. How was he on the plane?
He did great. He slept the whole time.
Oh
which
my
was-
gosh,
which was
that's
really
amazing.
Nice. So
That's amazing. So you weren't the family with the baby? I've been that family before. So
yes,
hats
no,
off to
thankfully
Archie.
we were not this time anyway. So, but yeah, he loved it. He had a great time.
So when did you learn that Archie had a heart condition?
We learned at our 20-week ultrasound appointment. So yeah,
And how did they explain it to you?
I think they explained it to us that something was abnormal, but they weren't really sure, and we were going to monitor. And then I think later down the road they said once he's born, we'll do like the echoes and things like that to where we'll know more about his heart condition. So
boy, that's stressful.
Yeah, it was
first
stressful.
baby.
Yes.
This is your first rodeo.
Yes.
All the emotions and hormones already on top of that, the stress of this. Archie was born 9 weeks early.
Yes.
Was that a surprise, or were you induced?
No, that was a surprise.
Oh,
we
wow.
knew kind of that maybe we were at a higher risk for early labor, preterm labor, due to the shape of my uterus. But I was at work one day and my water broke, and then we came here, and they're like, we're going to hang on to you until he comes. And then I think a few seconds later, they're like, okay, we're going now. And so they just wheeled me in, and he came that day. So
I always wonder this when people say their water broke. Where were you? Were you just standing in the middle of a meeting and water breaks?
Well, thankfully I was at least in my office, and I had just gotten finished with a meeting. And then I remember calling my friend who's right next door to me, and I was like, I think because she's a mom of 3, and I was like, I think my water maybe just broke. And
oh my gosh.
Yeah, she was like, try to go to the bathroom and let's figure it out. And I couldn't even get up. So
it was time.
Yeah.
So Dr. Gertz, I want to bring you into this. Okay. What was Archie's exact diagnosis? What's it called?
His diagnosis is called tetralogy of Fallot. It was described in the 1870s by a French physician named Fallot, which is why we give it the name. And there are 4 major components to it. There is always, or almost always, a large hole between the 2 pumping chambers. There is variable degree of obstruction to blood flow going out to the lungs. This position of the ventricular septal defect causes the aorta to override both pumping chambers instead of being dedicated just to the left pumping chamber. And with time, thickening of the right heart develops. So those are the 4 components.
Is this rare?
No, it's actually the most common blue baby or cyanotic heart defect that we see.
What's blue baby mean?
Blue baby means color is lower than normal.
Oh, okay.
So your oxygen levels are lower than 97%.
And we're going to get to an image we want to show you. Did Archie look blue though? Did his skin look blue?
He would we would call them like spells, where he would turn blue because of the lack of oxygen.
That's alarming to see.
Yeah, it was very scary.
We have he's rosy cheeked now.
Yeah, he
So
is.
again, this story has a happy ending. But we do want to bring up those images of what a healthy heart looks like compared to one that has Archie's condition. So when we look at those images, Archie's heart would be on the left, and the right is a perfectly healthy heart. Did I get that right?
Yes.
In the screen there?
Yes.
And what are you seeing on the left in that image?
So you see that if you compare the 2, you see that there's a hole at the upper part of the ventricular septum, which goes from the tip of the heart down at the bottom of the picture up to where all the blood vessels look.
Got it.
You look at the pulmonary artery, the blue thing that looks like a T, and that looks smaller than the one on the right. So that you have the hole, and then you have a bulge underneath that blue T. That's the obstruction or pulmonary stenosis. So those are illustrating the main components of tetralogy of Fallot.
I think Archie wants his mama. Do we need to hand him over to you?
I don't know. Yeah,
Let's
we can
see what
try.
happens.
You may want a snack too.
He might want a snack.
We had to
He
wake
might
him
just
up
wanna
this
hang out.
morning,
He
which
might want
he's not used
attention.
to.
He might want our jobs.
Do you want to say hi?
While Archie's
hi to
there, let's take a look at him now. Look at
Got
those
his
rosy
lost his
cheeks.
shoe.
What
Say
I
hi.
noticed when Archie came into the studio in his mom's arms and saw Dr. Gertz was he was obsessed with staring at you. He was reaching for you. He had a book. He kept tossing it towards you. It was so sweet. I want to show you this. So it took forever to find. We looked for a walnut because a baby's heart is the size of a walnut. Apparently, no grocery stores in Kansas City sell walnuts in the shell. So picture this. The heart is actually smaller than a strawberry, about the size of a walnut. Dr. Gertz, how do surgeons operate on something so tiny? It would be half the size of this.
Well, they have over the years developed instruments that can work inside a heart that's that small. The techniques to putting a baby's heart on heart-lung bypass have improved tremendously from the 1950s when it was first started all the way to now. Surgeons use magnifying lenses in order to see where they're placing the sutures. So it's the heart surgeons who do congenital heart surgery do at least a minimum of an extra year of training, and then often work for a number of years underneath a senior surgeon to develop the techniques and the skills to do this type of operation.
And you shared some images of Archie's actual heart with us. This was taken before Archie's surgery. What do you see here?
So if you look at the stream there of red that you can see, that is showing flow going across the hole between the two pumping chambers.
Okay.
The blue going out is blood flow going into the aorta. We don't see the pulmonary artery in this view. And so that's at least one of the main components of tetralogy. That's a big hole sitting between the two pumping chambers.
And before we get to our amazing NICU nurses, I want to show one more image after Archie's surgery. Now tell us what you're seeing here that shows such success.
Well, if you look, there's no flow through. It's a similar view. There is no flow going across between the two pumping chambers. You do see stream of red there at the top coming back, and that's what Archie's mom talked about briefly about his last checkup, that there is some leak coming back into the right side of his heart from the pulmonary valve. So that's what is being shown on this particular echocardiogram view.
And that's what you're monitoring now. We have one more video, actually. I fibbed. One more video coming up in the monitor behind us. And this time I would love for you to explain to us what we're seeing on the left and on the right.
So this is called an apical four-chamber view. You can kind of see the tip of the heart, and then you see again the big hole between the two pumping chambers, and here you can see both red and blue crossing through that hole. So this is showing that there is flow from the right side of the heart going directly into the aorta, and flow from the left side of the heart, which is on our right, going into the aorta. So you're seeing the mixing of red blood and blue blood together, which is why oxygen levels are lower.
The blue baby.
The blue baby.
That's why you had that. Allie, how important was it to you? I mean, you spent the first 3 months, your baby did, first 3 months of his life in the hospital. We talked about all the regular emotions you have as a new parent. How much did you rely on the NICU nurses to help you and your family emotionally?
Oh, a lot. Yeah, with him being our first, and kind of a journey to even get to him, and then this all happening, and then us being in the NICU. You do kind of have to just put your trust. I mean, you don't really have another option, but I mean, thankfully we lucked out with an amazing NICU, and obviously Mallory and Carly are so important in our lives still. So Yeah, but the whole NICU here, I mean, they just, they take care of the parents too and the babies. So they made us feel like family, and just every concern or worry, they comforted us. And so
when we first contacted you to come on this program, Allie, you said it was crucial. I've got to have Mallory, I've got to have Carly, I got to have Dr. Gertz. I want to ask Mallory, is emotional support for families part of your training in nursing school?
I actually took nursing school like 18 years ago, so I'm trying to remember that. I feel like if it wasn't a huge part. I feel like that's something you kind of just learn as you go on. And I feel like wanting to be a nurse anyway, it's like we already have that kind of feeling where we want to be that for people. But I feel like I got better at it as I went on too, just because, it's just on the job, just things that experience really helps.
Sure.
And then I also feel like it changed a lot. There was something that clicked when I had my own children. Wow. I suddenly just was able to empathize better, and it was just easier at that point.
Carly, how do you comfort a parents, grandparent who are feeling possibly the most emotional stress that they'll ever feel in their life?
Yeah. I think of two things with comforting parents. One, I think community is a huge aspect in all seasons of life. So when we have long-term NICU stay families, we as the NICU staff become their community. And so I think just making time and taking the time to connect with them on a more personal level can help ease their comfort. But then also allowing them to be more in control, because I think anxiety stems from having a lack of control in a situation, but there's not much you can do in the NICU.
Right.
So we let them participate in cares that we do, and we allow them to be a part of decision making with the medical team too.
We talked about Archie needing oxygen. What were some of the things that Allie and Andrew were able to participate in, other treatments and types of care that you gave Archie?
So every 3 to 4 hours, we'll cluster our care with the babies. So we will assess them, do diaper changes, all the vital signs, their feeds, everything that they need, we cluster so they can rest in between. And all of those cares, besides the assessment, obviously, we allow parents to participate in.
Wow.
And Dr. Gertz even
he
participates.
So you're up there too?
Sometimes during those times.
Yeah.
He liked to come in and change his diaper and do his temperature.
That's so sweet. Is that part of your rotation? Part of your, is changing diapers and being in the NICU part of the job?
Well, consulting on babies that I am responsible for is part of the job. I have 2 boys that are much older than Archie.
So you changed plenty of
so
diapers.
I changed plenty of diapers. I had cloth diapers back then, so I didn't even know how to safety pin a cloth diaper without sticking my fingers.
You're a pro.
So I'm used to taking care of diapers and babies, and it's, sometimes if the nurse is out and something needs to be done, I'll pitch in and try to do some basic stuff. Plus, having a happy baby when I'm examining them is important. So doing things that make them less fussy.
Team effort.
Yes.
A big family effort. Mallory, what were some of the milestones that you were watching for Archie to reach before he was able to have this surgery? How do you work with the cardiologists on reaching those milestones?
So he can probably say better what we're looking for, but we just mostly, care for them, try to grow them bigger, because basically they can't do the surgery until they're, they want them to be bigger. Like, I feel like 3 to 6 months is a typical time. But especially because he was premature, we needed to, get him to where he could be in an open crib, get him to where he was tolerating all his feeds and all those things, because he started out in an isolette. And so we pretty much just treated his symptoms and kept him going to where he could just grow bigger.
How do you grow
little blue cells? And we would just, find ways to help him through those, turn him on his tummy, things like that.
And Carly, what are the things you're monitoring for? How do you grow the baby bigger?
Well, like Mallory was saying, feeding in time, and then managing those spells, because those spells do reduce. They take a lot of energy out, which burns a lot of calories. So it's difficult to balance it all. But
sure. So what they're medically going through is burning way more calories than what a baby would burn sleeping and being a typical healthy baby.
Yes. Especially being as premature as he was.
Right. And then, boy, he's in good shape now. Yeah. I think he's trying to stand on the desk. I've noticed Archie perks up when he sees himself on the screen, which is nice. There you are. There you are. Now he's got to figure out what camera to look at. Don't worry, none of us can figure that out either. Dr. Gertz, why is 10 pounds the magical weight to reach to undergo surgery?
It's not always the magical weight, but Archie had some characteristics of his tetralogy that were a bit unique. The level of obstruction below the pulmonary valve was fairly long. So it was going to be a complicated process for the surgeon to get rid of as much of that as possible.
Got it.
So we do not do infant cardiac surgery at KU, but I work very closely and in conjunction with cardiologists and with the surgeons at Children's Mercy. So I was in back and forth conversation with a couple of the cardiologists who were then relaying information to their surgeons about Archie's condition and what our goals were. So this was actually a triad of management here at KU, pediatric cardiologists at Children's, and congenital heart surgeon at Children's. So combining all of that to try to get what our targets were. We picked 10 pounds as a weight that we hoped we'd be able to get to, which would allow a good chance of a good repair.
How much does Archie weigh now?
He's like 20 pounds now.
Nice.
Yeah.
He's doubled.
He has doubled. Yeah. Yep.
What does a typical day look like for Archie now?
Well, I stay home with him right now, which has been so nice. So we'll usually try to go to like a story time or get outside, and we try to do like an activity each day. And
typical baby stuff.
Yeah.
A very atypical way to start his life, but now you can be a mom.
Yes.
And just a mom.
Right.
Maybe a worried mom.
Yeah.
With a little extra worry, but still you get to have a normal life with him.
Yeah. Yep.
Looking back, was there a moment you realized you were out of the woods, that you could finally relax?
I was thinking about that the other day, and I honestly don't think it was until maybe we were home. I don't know, just because, we worked, we didn't work so hard to get to a surgery, he did, but, it was always like, how much does he weigh today? Every day it was just day by day. And then it was, okay, we have to leave KU and go to Children's, and when is this going to happen? And then, okay, when are we going to do the surgery? And then after his surgery, he got neck, which was like an infection, and had a couple hiccups afterwards, and then they were like, all right, you're ready to go home, and
you're like,
got
what?
Home, and
I'm not used to just going home.
How scary was that?
And then it was so scary to be home, and we had a rough couple months, and then it was almost like after that we kind of figured things out, and he figured things out, and now it's pretty normal. I still have worries a lot and stresses, but not as much as before. So
we're getting some questions from the community. We love our viewer questions, so be sure to send them to us on YouTube, Facebook, the X platform, and the All Things Heart email. You can connect with us in real time with the links right on your screen. And some of the questions that have already been submitted, let's get to those. Macy wants to know, when a baby's in the NICU, are parents allowed to sleep there? I'll ask Mallory this.
Yes, they are. We have a couch that has like a pull-out, And then, so I mean, parents can stay as often as they want, but not more than 2 people.
Not more than 2 people. And to piggyback on that question, June wants to know, can you ask Allie how she held it together? How did she and her husband manage to keep working and functioning through all of this? I would have been a wreck. How did Andrew, well, you have to talk for Andrew because we don't have, he's Mike.
Yeah.
All right, did you have to keep going to work every day?
Yeah, so I went to work every day. Allie went to the NICU every day. And
How do you even focus at work? Are you just a zombie in another planet?
Yeah. Working in an elementary school, sometimes you're just a zombie anyway.
You're a teacher, okay.
No, for me it was a nice. I had to focus on something else, right? I had to be at work to provide financially, those kinds of things. So it was a good focus, like a refocus. And then after work, I'd come up to the NICU.
Go. And then how did you do it, Allie?
I'm not sure. I mean, with the help of the people in this room, and I did not go back to work. I resigned, and I just couldn't leave him. You know, I had to. I wanted to be up there every day, and you know, we don't have other kids, so it was like I could devote my time to him and being there, and but yeah, I was a wreck. So I mean.
So that's an honest answer. June, they were wrecks, but they kept going.
Yep, you just keep going and do what you have to do. So.
Talia has a question for Dr. Gertz. Talia wants to know if Archie's going to need to see a cardiologist the rest of her life.
The simple answer is yes.
Okay. All the time, every 6 months, how often?
It's going to vary, and as he gets older, it will be less and less often, but Archie will need follow-up indefinitely. There are problems that can develop with tetralogy of Fallot after repair, so it's important to maintain good care and follow-up. One of the key points in life is transitioning in adolescence, young adulthood between pediatric cardiology care, where we hold hands very tightly, to adult cardiology care, where you're a bit more loose and kind of on your own. So helping children and parents get through that part is one of the things, and that's 15 to 18 years from now for Archie. So
and then you're still worrying about them.
And they're still worrying.
I mean, I'm 50 and I'm still worrying about my son who's he's a junior in high school. It's time for some final thoughts from our guests. So Allie, I want to start with you. What do you most want our audience to know?
Oh man, I guess like June asked, just how do you get through the NICU? You know, I feel like it was just such a exceptional experience. You know, like just I don't know, make yourself aware of NICU and heart defects because I had no clue before, and now obviously it's very important to us. But yeah, I mean, just. The staff, the NICU nurses, the doctors, you know, just how amazing they are, and just, make yourself aware of those things. So,
Carly, as one of those amazing NICU nurses, what's it feel like to sit next to Allie and see Archie so healthy and happy?
It's pretty amazing. It's been fun to watch him take his first steps and do all the reach all those milestones that babies normally do. I remember a time that Allie, this was a scary time, Allie and I were in his room one day, and he was not able to come out of one of those blue spells quickly, and it's hard to go from seeing that, not being able to see a light at the end of the tunnel, and then going to watching him walk and talk and read and do everything he's doing.
Milestones.
Pretty great.
Yeah.
Mallory, is it rare for you to be able to see how patients and their parents are doing after they're finally out of the NICU?
Not really anymore, especially with Facebook and everything. And then also we have a reunion each year. Everybody's invited to, and it's usually a really good turnout. And we get to see all those kids. Sometimes parents will send like birthday cakes and say, here's a picture of my child. They were this year. They're 12 now, they're 15 now, so we've had them come in and see us when they're 18. It's just like,
that's special.
You just get to kind of know them. And then any of my primaries I just still talk to. I try to I have play dates and stuff with Archie to see him every couple months. So
That's great.
Yeah.
That's cool. That Archie's nurses have play dates with him.
Oh, yeah.
Still,
It's very
Dr.
special.
Gertz, what would you like our viewers to know?
Well, I think this is emblematic of what it takes to take care of a high-risk situation, a complex problem. It is not just the surgeon, and it's not just the physician or cardiologist. It's the nurse, it's the parents, it's the rest of the team that provides the opportunity. I mean, we had to get Archie to grow. We had to take care of multiple problems along the way.
Yeah.
So it's important that it is in fact a teamwork. And for us here at KU, it's that team extends beyond our boundaries to another hospital system. So
Yes.
it's learning how to work collaboratively.
And we love sharing the incredible work that our care teams do, saving lives. We also love showing you what life looks like for them outside the hospital.
Now for a secret look into the guardians of healthcare at the University of Kansas Health System. Let's go behind the mask.
Dr. Gertz, you're up first. And fun fact, you have a better half that's also been on our programs. She's in these pictures.
I do. My better half is Sally. She's a nurse practitioner in general pediatrics. She's a Spanish speaker, so a lot of her families are Spanish speakers. And these pictures are of us doing things that we like to do. So there's a hike that on the left-hand side in Texas, where we were just gathered with all of our families, our New Mexico and Ohio families. The middle one is a picture of my wife in New Mexico, which is where we've gone since 1986.
You have an important tie to New Mexico and the Boy Scouts.
That is correct. I'm the chief medical officer for the National High Adventure Backpacking Facility, Philmont Scout Ranch. So I've been that since 1988.
Wow.
And then the last picture, and a plug for the KU Alumni Association trips. That's a picture of my wife and me snowshoeing in a winter. We just took a winter trip across Yellowstone in February, and it was gorgeous and probably one of the most exceptional experiences we've had to be there when it's snowy, isolated, and just beautiful.
Those are great pictures. Awesome. Mallory, when you're not taking care of babies, you mentioned you're taking care of your own babies and your own family, so tell us who's in these pictures with you.
It's my husband Vince, and then my daughter Mavi, she's 9, and then Knox is 5. He'll be going to kindergarten this fall. But we like summer, water, lake, swimming, all that. You know, so that's us at the beach.
Great pictures. And Carly, you clearly love mountains and climbing rock walls. You like climbing tall things. Just explain these pictures to us. And also, we're going to get to some images that show how your work life and personal life intersect.
The far left picture is my boyfriend Tristan and my best friend Ellie in Colorado. I actually would prefer the beach, but my boyfriend always wins.
Drags you to the tops of mountains.
It's true, but I do love to rock climb, and those are my friends in Arkansas who we climb with.
And who are you holding in the picture on the right?
That is my college friend's baby. I can always find the babies. You can never escape them.
It's so sweet. And then sometimes you even hang out with, hold on, who's that in that picture?
That is my little archman.
Where are you guys in these pictures?
Allie,
we went to Casual Animal Brewery.
I love that
we just chased him around the whole time. So
that's amazing.
One of our meetups, yeah.
Talk about a team effort and a family. Archie, this is the best behaved baby I have ever seen. We were, it's risky bringing a baby onto a live set, and Archie nailed it.
Gotta have the snacks.
Yeah. Thank you so much to the Cook family, to Grandma, Dad, Allie. Thank you for sharing your journey. Dr. Gertz, Mallory, and Carly, thank you.